Good afternoon, everyone. Now, I would like to invite, this is the Twilight Webinar 3, and I would like to invite Master of Ceremonies, Dr. Ritu Shilp and Dr. Joffi Chacko to start the session and invite the speakers.
Good afternoon, ma'am. Good afternoon, all my faculties and all viewers. We are going to start our Twilight by RMS webinar part 3. And this is our third webinar of RMS. Uh, I would like to introduce our society organizing team, Dr. Asha Jain ma'am, Dr. Shalini Jain ma'am, and Monika Pathak ma'am. Also, without wasting time, we are going to start our first session. First session is on Hot Flashes Beyond Menopause by Asha Jain ma'am. I would like to invite our chairpersons, Dr. Rajni ma'am. Dr. Rajni ma'am is director at Karma Hospital. We all know her very well. She is very renowned vaginal surgeon and past
very good result in pregnancy
president
to
2008-2010. Next, Dr. Monika Pathak ma'am.
as a bleeding में clotting में बहुत serious इसको
Dr.
1
Monika
month देना
Pathak
पड़ेगा
ma'am, she is president
क्योंकि अगर
RGS
टाइप से
at
दे देंगे
present
तो नहीं होगा
and treasurer of
1 month
RMS
देते
at
हैं
present.
थोड़ा सा
Dr.Rashmi ma'am, she is director at Guru
क्योंकि
Kripa
सिवनी
Nursing
मेरी सेल
Home
का
and
वाला
treasurer, executive member of RGS and joint secretary of RMS at
ज्यादा
present.
नहीं 1 prescription
Dr. Saurabh Birthare
थोड़ा
sir,
सा
he is executive member of RMS, and Dr. Joffi ma'am, she is non-faculty and Joffy's
Persons who are
Wellness
not
Clinic. She
speaking,
is
please unmute
director and
yourself.
gynecologist at Joffy's Wellness Clinic. So,
Ritu, please unmute yourself. I have muted everyone, so there is no disturbance. So you can unmute and start talking.
yes, ma'am. And next chairperson, Dr. Sanjana khemka ma'am. She is faculty at Balaji Hospital, Narayana Hospital. We all know very well. And now I request Dr. Rajni ma'am to introduce our speaker on the hot flashes. Rajni
Wait,
ma'am.
just a minute. May I say a few words?
Yes, ma'am.
So, dear friends, we officially welcome you to this third episode of Twilight. Actually, 4 of us attended the IMS Con 2024. Me, Dr. Jyoti Jaiswal, Dr. Sushma Verma, and Dr. Ritu Jain. We all had talks there, and because when you are giving a national talk, you make an effort and a lot of work is done. So we thought that our own members are missing out on what we are doing. So for that purpose, we decided to hold this meeting, to have everything online for the benefit of our own members and anyone who wants to attend. So this is the brainchild behind this meeting. So these are the 4 talks that we have all 4 done at IMS Con 2025. And we will be producing it here for you all so that we can all benefit. We revise ourselves and everybody else gets the benefit. Thank you so much for agreeing to participate here. So now you may please go on. Dr. Jyoti, if you would say a couple of words and then we actually take the program forward. Otherwise, it's becoming too much of padai.
Thank you so much, Asha Didi, for organizing this webinar and thinking so positively that many a times we all cannot go and attend the national conference, and whatever is being delivered there, our own people should be a part of it. And we are really very happy. Maybe a little bit new things, maybe many more old things we will reiterate in these lectures. But these are the gist of managing menopause in the different ways, on the different aspects. And I will like to say that this INSCON, after a long time, I had a feeling of Team Raipur Menopause Society. That was the best part. I was with Dr. Asha Jain Madam at the same hotel, and we had a wonderful time together. We have much with the caring and sharing. And definitely, Didi being the elder, she took care of me very nicely. I had a very nice time to the Bithur Love Kush Mandir and Atal Ghat Ganga at Kanpur. That was also a lovely bhajan kirtan and a very serene experience that day. And after that, मन की पूरी इच्छा हुई when I got opportunity to take dip in the Sangam and भगवान का आशीर्वाद वहां से मिला और बहुत सी थोड़ी डिफिकल्ट जर्नी के बाद I came back to Raipur. But the lovely memories we all four together could share there. A suddenly planned Chhattisgarhi dance with the our Rajki Geet, which was the brainchild of Asha ma'am. We all were thinking that we should do something Chhattisgarhi. But she said ki if we are doing something Chhattisgarhi, we can take the headlines of our Rajki Geet. And we did a little here and there movements, but they were very soothing. And बाकी लोगों को जैसा भी लगा हो, we were very satisfied to showcase our state in a beautiful way. And we all enjoyed this trip a lot. And I think that whatever we listened together, because I could not attend all other three lectures, so I am looking forward to attend all those three lectures, which I, even being at IMSCON, I missed to attend. So this is the great opportunity to listen to you all three here, which I could miss there. Thank you so much.
Thank you so much, Jyoti.
Thank you, ma'am. Now I request our chairperson, Dr.Rashmi ma'am, to introduce our speaker on hot flashes. Dr.Rashmi ma'am. I think ma'am is not there. I request Dr. Joffi ma'am to read the. Yes, ma'am.
Good afternoon, everyone.
Rashmi ma'am is here.
She is
Hello?
medical director. Hello,
Yeah, ma'am.
am I audible?
Yes, you are.
She is medical director for Cancer Prevention and Relief Society. She is an elected member of CG Medical Council for 2025, chairperson Foxy FDMC committee, president. At present, she is president Raipur Menopause Society, and she is executive member of CGISR and CGSFM. Now, she has been special interest, as everyone know, ma'am has a special interest over oncology and colposcopy. And in this way, she is very much interested in saving the uterus. She's interested in fetal medicine as well as in menopause management. An academic interest is she is an ISS, CCP, IFSP, IRC colposcopy trainer, certificate course and trainer FSS OB, IOTA certification from IOTA Group, and she has a certificate of competency from Gynec Academy in Gynec ultrasound fetal.
Ma'am, unmute yourself. Dr. Rashmi is muted somehow.
I welcome Asha Jain ma'am for her talk. Ma'am, am I audible?
Yeah. Now, right now you are audible. I think there is some lag in the link.
Yeah.
I think it will be sorted shortly.
Yeah.
There's no lag. I was having my last bit of tea.
Ma'am, it's not good. आप अकेले अकेले हमको भी पिला लेते हैं साथ में.
वेबिनार में कैसे पिलाएं दीदी, ले लीजिए.
बोल देते कि सब अपनी अपनी चाय लो, हम लोग cheers करते और सब साथ लेते. First of all, I like to say a few words, ma'am. Can
Go
I?
ahead. Go ahead.
It was really lovely. Thanks to all of you for inviting us for today's webinar. And it was really a very proud moment for us to see all four of you there in the national platform. Dr. Asha Jain ma'am, Jyoti ma'am, Sushma and Ritu. It was really a very proud moment when we saw you representing Chhattisgarh and felt so good that you have left no platform. You could, after academics, you could do that cultural program as well. We saw the glimpse of it and we really enjoyed along with you. So, really wonderful. It was great. And happy that you people are sharing your talks here so that even we are also updated with the latest things which you all have delivered in the national platform as well. By sitting here, we can experience the Kanpur and the dip of Prayagraj with Dr. Jyoti and experience. Hope we all get the punya of that Prayagraj here as well. Now you can go ahead, ma'am.
Thank you so much, Monica. And thank you, all my dear friends who have logged in here. So, my topic, is something that we don't usually think about. And that is when hot flashes are not due to menopause. We think hot flashes means menopause. So, basically, this is what I'm going to speak about, hot flashes which are not due to menopause. And this is the paper. It's actually a complete CME on the flushing patient, differential diagnosis, workup, and treatment. This is where I have taken the material from. So we are going to understand the causes, the diagnosis, and the management. In the introduction, what is a hot flash? It is a transient skin redness due to vasodilatation. The mechanisms involved are the neurogenic mechanism, the pharmacologic mechanism, and thermoregulatory mechanism. There are certain common causes we are all aware: fever, emotions, rosacea, menopause, and alcohol. This will cause severe vasodilatation and flushing. But there are serious causes. And these serious causes are carcinoid syndrome, mastocytosis, pheochromocytoma, and then medullary carcinoma of the thyroid, pancreatic cell carcinoma, renal carcinoma. All these can also cause hot flashes. So now how are you going to differentiate? What is going to be your diagnostic approach? Like everything else, the diagnosis will depend on the history, then the test that you're going to advise, and then proceed to imaging. So the first and the most important part is the history. Now, there are certain pharmacological mediators of flushing. What does this actually mean? Things that you are eating, foods, beverages, and alcohol, which would be containing tyramine, histamine, sulfite, nitrite, alcohol, aldehyde, higher chain alcohols, monosodium glutamate. With these days, everybody having Chinese, monosodium glutamate is there everywhere. Capsaicin, ciguatoxin. Then there is the climacterium, which is because of estrogen fluctuations, carcinoid syndrome, 5-HT variation, but it is accompanied by diarrhea, substance P, histamine, catecholamines, prostaglandins, kallikrein, kinin, tachykinin, neurotensin, neuropeptide K, VIP, gastrin-related peptide, and motilin. Then again, you have pheochromocytoma, which is catecholamines, mastocytosis, which has histamine, anaphylaxis, again histamine, medullary carcinoma, which will have calcitonin and prostaglandin, pancreatic cell carcinoma, again the VIPs and prostaglandins, renal cell prostaglandins with pituitary downregulation, neurologic substance P and catecholamines. So basically, these are the different substances that will alter. And what is the differential diagnosis? You can have this entire list. Benign cutaneous flushing, uncommon serious causes, other causes, psychiatric or anxiety disorders, idiopathic flushing, neurologic, and then these are the very, very rare causes. And we have to remember that the common is common and the rare is rare. And so whenever you have a patient, you have to think of the common causes first before you start taking that this is an abnormal or rare cause. So here is a comparative chart. by history, physical examination, and lab findings. I think this is one chart that everybody should take a, you know, take a screenshot, because it tells you in one chart what you need to test, what you need to ask, and what you are going to find in your lab findings. So in fever, it can have sweating, elevated temperature, and illness, but no key specific finding and no lab finding. Benign cutaneous flushing, the same. Rosacea, you will have triggering factors and ocular symptoms. On the physical findings, you would have papules, pustules, telangiectasia, flushing limited to the face. Climacterium, the history is the most important. The irregular periods, 5th, 6th, 7th decade, or immediate surgical menopause. Frequent, brief episodes with profuse sweating. So you can have up to 20 episodes in a single day. Flushing of the head, neck, and chest, and usually associated with elevated FSH. But you don't have to check it to say that this is menopausal. Then you have carcinoid, which is accompanied by hypotension, tachycardia, abdominal cramping, diarrhea, and bronchoconstriction. And here you have to give a 24-hour urine for 5-HIAA. This flushing is reddish brown or bright red, maybe widespread, including the palms, and then it can lead to permanent telangiectasia. As you know, for hot flushes, it comes and goes, but here it is permanent for hours together, sometimes for days together. Pheochromocytoma, you have hypertension. Carcinoid, you had hypotension. So you have sustained or episodic attacks, sweating, palpitation, chest pain, abdominal pain, nausea, vomiting, headache, and a sense of impending doom. And you have the VMA, 24-hour urine sample VMA has to be tested. Mastocytosis, you'll have cutaneous mastocytosis, urticaria pigmentosa, TMEP, and then serum tryptase is persistently elevated, 24-hour urine for N-methylhistamine. Anaphylaxis, I think we are all very, very, very aware of. It is triggered by something. It is very immediate. There's urticaria, angioedema, and you don't actually have time for anything. You actually need to treat it first. It's very, very immediate, but serum tryptase is elevated only during the attack. Medullary carcinoma may be personal or family history. Pheochromocytoma, hyperparathyroidism means the patient can have multiple endocrine neoplasias. There is protracted flushing, persistent discoloration, and telangiectasia of the face and arms, also with a thyroid nodule. You have to do a calcitonin level. Pancreatic cell tumor, prolonged watery diarrhea, abdominal pain, nausea, vomiting, lethargy, weakness. You will have elevated plasma VIPs. Renal cell, hematuria, flank pain, abdominal mass. You'll have an abdominal mass and you'll have hematuria. So this is a basic thing that you have to remember. And these are the list of medications. A simple caffeine withdrawal. Somebody was taking a lot of caffeine and has stopped taking caffeine. They also can get flushing. So flushing, this is a partial list, as you can see. So nicotinic acid. Today, medical companies are coming up with a lot of nicotinic acid to deal with menopause. And all calcium channel blockers, all vasodilators, beta blockers, methylprednisolone, catecholamines, prostaglandins, NSAIDs, nicotine, tobacco in different forms. अपने यहाँ गुड़ाखू भी बहुत होता है. Cholinergic drugs, bromocriptine, chemotherapeutics. A simple antiemetic can also cause flushing. So you have this. This is a very partial list, and it can go on and on, which causes flushing. There are industrial solvents which, when combined with alcohol, may cause flushing. That is trichloroethylene vapor, N-dimethyl formamide, N-butyryl doxim in the printing industry, carbon disulfide, xylene, thioureum derivatives in the rubber industry, and medicines. We all know metronidazole and disulfiram, but there are others. Metronidazole, ketoconazole, griseofulvin, simple cephalosporins that we use left and right, chloramphenicol, antimalarials, calcium carbamide, phentolamine, quinacrine, benorelate, and tacrolimus topically applied can also cause flushing. So common versus rare. We are more worried about common versus rare, and then benign versus pathologic. So benign are episodic, no systemic, and the pathologic are persistent and systemic. Benign are episodic, pathological are constant. Diet and environment has to be checked. Spicy food, alcohol, stress, heat. Systemic conditions, neuroendocrine tumors, autonomic dysfunction. And how do you work up such a patient? By a symptom diary, lab markers, and imaging. Benign cutaneous flushing. Triggers are emotion, exercise, food, heat exposure. Key features is that it is localized to the face and no systemic symptoms. Management is cooling, avoidance of hot environment, beta blockers, and behavioral therapy. Rosacea. This is erythemotelangiectatic, papulopustular, phymatous, and eyes are affected. The triggers are heat, alcohol, spicy food, and stress. And the treatment is topical metronidazole, oral antibiotics, and laser therapy. Menopausal, we all know it is because of estrogen withdrawal, which disrupts the thermoregulation. There are hot flashes, sweating, anxiety. The management is HRT with caution, SSRIs, gabapentin, clonidine, and lifestyle changes. Carcinoid syndrome, we've discussed this. The treatment is octreotide, tumor resection, and chemotherapy. Pheochromocytoma, treatment by alpha blockers and removal of the tumor, mastocytosis, antihistamines, mast cell stabilizers, and avoid the triggers. Anaphylaxis management is adrenaline, antihistamines, airway support. Medullary thyroid carcinoma causes secretion of calcitonin, prostaglandins, and histamine. The symptoms are persistent flushing and thyroid nodule, so you'll be able to feel the nodule. Test the serum calcitonin, do the RET mutation test, and remove the thyroid. That is the treatment ultimately. Medications, find out and stop if possible, or give aspirin pre-medication in case of niacin flushing. Alcohol, again, we have ALDH2 deficiency in these stations. So drug interactions are there. Basically avoid and use aspirin. So workup and management, we come back. This I have already said. This is the chart that is my take-home message to everyone. What happens when a patient comes to you with flushing? Take a history and examine her physically. Then once you have examined her physically, if there are any systemic features or what the history suggests, accordingly, if the history suggests something serious, then rule out the most common serious causes. 24-hour urine for 5-HIAA, VMA, NE, metanephrine, PGD2 metabolites, serum serotonin, tryptase, histamine. Rule out less common causes by urine analysis, VIP level, endocrine referral, and allergy referral. And then consider other rare causes, psychiatric disorders, or idiopathic flushing. Then, according to the history, do the lab evaluation, confirm the diagnosis, and treat based on the diagnosis. It's as simple as that. Treat based on presumed cause, rosacea, fever, emotional, climacteric, neurological disease, diet, medication, alcohol. So basically, use a lot of common sense, do a thorough examination, take a detailed history. If needed, ask the patient to keep a diary of her symptoms and review after 2 weeks. With the details of the history, you will be able to diagnose more than 95% of your cases. And whatever remains, you can always refer. Everybody has to make a living. So most flushing, what is the key takeaway? Most flushing is benign, but serious conditions must be ruled out. Identify the triggers, systemic symptoms, and lab markers. Treat the underlying cause, from lifestyle changes to surgery. Emergency anaphylaxis requires immediate epinephrine, and refer to specialists if flushing is persistent or unexplained in spite of all your efforts. Thank you.
Thank you, ma'am. Now I request Dr. Monika ma'am to conclude the topic.
It was really wonderful, ma'am, and very unusual topic. Yeah, we were in a menopause society. We were so much used to knowing only and only hot flashes due to menopausal symptoms. But you have very nicely and schematically you have pointed out all the other conditions where we may be have to be vigilant about, and take very rightly said that. Detailed history and examination can help us to you come to the conclusion that these hot flushes are not related to menopause but some other serious underlying cause can be missed out if we are not vigilant. It was very nice and very informative. It was a wonderful talk, ma'am. Thank you so much.
Thank you. I hope somebody will make a comment that it was also very short.
That is always
It was
there.
very
Yes,
short
ma'am.
and crisp, ma'am.
Very
The
Very,
talk is
Very
always
short,
on the
very
practical,
precise.
yeah, very practical tips. And
and to the point, and in time you finished, ma'am. That was more good.
yes,
And most important, madam, treatment is there in every slide. Not
yes,
only the management, but treatment part is also there.
true, true. आई थिंक कि आशा
Thank you
मैम
so much.
आपका हॉलमार्क होना चाहिए कि आपको जो गिवन टाइम रहता है उससे आप बहुत पहले ही कंक्लूड कर देते हैं सो दैट इफ एनीथिंग वी वांट टू इंक्वायर और आस्क और वी कैन टॉक अबाउट अमंग आवरसेल्फ वी गेट सफिशिएंट टाइम दैट इज हॉलमार्क ऑफ यू कि आप बिल्कुल बिफोर टाइम आप एंड करते हैं
No, I finished in time. I was
you
given
cover
13
everything
minutes. So
but
I
you cover
finished in 13
everything
minutes.
yeah but you cover everything.
Thank you. Thank you.
Thank
So I
you.
think now time for the second session.
Yes, ma'am. So after this impactful talk, thank you so much, ma'am, again. So let's move
Thank
on
you
to
all
the
the
next
chairpersons.
topic. Yeah.
We should thank all our chairpersons also.
Yes,
Yes.
of course. Thank you so much,
Thank
each
you,
and
thank you,
every one of
Shravani.
us. Thank you, Monika ma'am. Thank you, Rashmi ma'am. She just joined us. I just saw her. Thank you, Sanjana. Thank you so much for joining in. And Dr. Rashmi ma'am, thank you so much. And Dr. Saurabh, thank you for joining in with us. Thank you.
Even Rajni madam joined for a while, I think. Rajni madam, thank you so much
She's
for
here.
joining.
Yeah,
She's
I
here.
just saw her glimpse for a while, and
Yeah,
she
for
just
a
She's
while
here.
I saw. And Monica madam, in spite of her or busy schedule, all the beautiful girls, Sanjana, Joffi, Rashmi, Saurabh.
Listen, we are all family. Nobody
That's
thanks
right.
anyone in the beginning.
Yeah, that's
Everybody
what I
has
was
to
about
come.
to say.
Everybody has to come. We are
That
all
was about
family,
to say.
right?
Yes, yes.
So after this impactful talk, let's move on to the next talk by our very own Dr. Jyoti Jaiswal ma'am. And let's hear from the expert herself, the next topic, that is the hormone-free zone, the non-hormonal strategies for menopause. So over to you, Dr. Jyoti ma'am. Once I introduce all my chairperson. So for this, we have Dr. Abha Daharwaal ma'am, and Dr. Reema, Dr. Sunita Kanoi, Dr.Sushila Khunte, and Dr. Ritu, my co-host as well. Next slide, please. So Dr. Abha Daharwaal ma'am, she's an associate professor in the Department of OBG in JNM Medical College, and she is the present vice president. And Dr. Reema Dilawari, the next chairperson, she is a consultant gynecologist at Gyan Devi Clinic, Devin Nagar, Raipur. Dr. Sunita Kanoi ma'am, she is a consultant gynecologist and she is a consultant at Shashwat Hospital, Raipur. She's done her diploma in advanced reproductive medicine and also in urogynecology. Next. And welcoming Dr.Sushila ma'am. She's a consultant gynecologist and a medical superintendent at Coal India Hospital. She's done her MBBS and DGO from JNM Medical College, and she's a fellow of multiple institutions like fellow of for Indian College of Obstetrician and Gynecologists and fellow of Indian College of Maternal and Child Health. Thank you so much for joining in. And also Dr. Ritu. How can I forget my co-host for today? She is the director of Shivpuri Multi-Speciality Hospital, Bhatapara. So over to you, Dr. Jyoti ma'am.
Thank you, Joffi. Can I share my screen, please?
Who is introducing Jyoti madam?
Jyoti yes, ma'am, you can share, ma'am.
Yeah. Dr. Sushila Khunte, can you please introduce our speaker?
Yes, ma'am.
I think Dr. Sushila, we
Yes,
all know each other, and I'm a part of this family, so I don't think that there is need of introduction. But
yeah,
I
ma'am.
will
Short introduction, ma'am. I'll give.
Few words, ma'am. Let us do.
Yes, ma'am. It's really my proud and privilege to introduce our beautiful diva, the great academician and the teacher of teachers, and my mentor from UG and PG days. And she is none other than Dr. Jyoti Jaiswal, madam, to this forum. Well, madam doesn't need any introduction, but for a short brief, she is a professor and HOD of OBGY department of our PTJNM Medical College, Raipur. She is a national treasurer of Indian Menopausal Society for the year 2024 and 26. She is vice president of CG ISAR chapter and general secretary of Raipur ISOP. She is treasurer of Chhattisgarh IEG Society. Madam has also organized successfully various
Sushila, thank you. Sushila, thank you.
Okay, ma'am. Welcome you, ma'am, for the talk.
Before starting my talk, I will like to appreciate Dr. Asha Jain's talk. That was really an eye-opener that we should do a DD before diagnosing that, yes, it is hot flash because of this reason. And she beautifully covered it well in time. So listening to the things which are even uncommon is important for the management point of some those patients who may have that. Some percentage of patient can have that. But listening to the problems which are, though they are common, and we have talked again and again about that, we know all the things about that, but still incorporating in our mind and day-to-day practice, those things are important for the larger benefit of the large part of the community is important. So these kind of topics kept for on repetition, and I have also given this talk in Gurukul, and I have taken this talk from the students' point of view, which has been given into the Meno Master. So many of my friends have already attended it. Still, I would like to just reread it again so that even one or two people are there who are listening for the for it again can have the benefit of it. So non-hormonal management of menopausal symptom, it includes basically a very simple things: diet, lifestyle, physical exercise, nutritional supplement, and few recommendations which we need to follow. And why non-hormonal alternatives when there are so beautifully given hormone like MHT supplementation? As we all understand that most of the time it is the estrogen which causes the problem related to the hot flashes, the imbalance, the lowering down of estrogen. Then the estrogen should be able to correct it. Why non-hormonal alternatives are required? So sometimes managing estrogen deficiency alone is not the problem, but the other support system is also important. So it can widen the armamentarium or treatment option. It can make our treatment part easier and supportive, individualized, and any treatment, if it is combined with lifestyle, diet, and exercise, the results becomes better. And hormone cannot do everything. If we are not doing exercise, we are not taking proper nutrition. Some women may wish to avoid hormones. Some women may have the contraindications. So in these patients and each and every patient, these non-hormonal strategies are important. The difficulty for giving some therapeutic options are little difficult because we have very less list of the licensed non-hormonal therapeutic options specifically for the VMS of menopausal hot flashes. There may be hot flashes because of any other thing. There may be antidepressants which also work good on VMS, but they are not licensed for the menopausal hormone therapy for VMS. So, as a side drug, we used to give, but it is not the first line drug. Coming for the balanced and the nutritious diet, sugar limited, salt limited, oil 2 tablespoonful per day, not more than that, fruit and vegetable daily incorporation, lot of water, not less than 8 glasses, add flaxseed, cinnamon, fenugreek, sauve, salads, curds, lot of these amounts in your diet daily. Tea, coffee, dairy products, keep it limited. Din bhar mat pijiye, only 2 cup, either tea or coffee. Consume a minimum of half a liter of the milk, or if you are not taking milk in the other form, in form of curd, it should be low fat. It will add on the calcium bank in the bones and add it because we know that we are not adding that much of the calcium by the milk, so we need to add, otherwise we need to supplement, take supplement. Add vitamin C rich fruits or vegetables, which favors calcium absorption also apart from the iron absorption. So recommendation, also add on few more things, not only in your diet, the calcium and the other routine, your thali, but also about the snacks, which is of a good quality. DHA, etc. is there. The memory correction things are there. So almonds, walnut, groundnut, dates, figs, apricot, fruits like banana, guava, high fiber, seeds like pumpkin, sunflower. Food that are rich in phytoestrogen includes lentils, kidney beans, bengal gram, soya bean. हफ्ते में 4 बार ये चारों चीजें incorporate we need to do. Now Sangi Sathi of calcium, that is vitamin D. So I will like to say here that calcium is required 800 milligram per day. Little, not impossible, but little hard to complete with your daily food if you are not taking a good quantity of the milk. If you are taking supplementation, 800 to 1200 is a range. Upper limit 2500 milligram per day, not more than that. Otherwise, it will cause a lot of side effects and lot of uneasiness. Vitamin D, daily requirement 1500 to 2000. Upper limit of daily intake if you are taking 4000. Monthly if you are taking 60,000. Okay, that means 2000 per day. Yearly if you are taking 6 lakhs unit in a year. So calcium. Calcium, as we said that it should exceed more than 800 milligram. That should be combined either directly by the diet alone or diet with supplementation. Risk of CV event, even if you are taking long-term calcium, but it is not more than 800 milligram per day, then risk of CV events and the calculi is not there, no increased risk. Prevention of kidney stone is possible if calcium is taken in the prescribed dose, in a smaller dose with sufficient amount of fluid. So you should take lot of water. The citrate is a preferable tablet because it causes less side effect. It has a good absorption because of the less side effects, and it is user friendly also. The cost is the only cause, only thing which is a problem. But if cost is a problem, any calcium can go. Condition that lead to calcium deficiency. So all those things which are related to intolerance of the high calcium diet, like lactose, limited use of dairy product, consuming large amount of sodium, high oxalate, aging itself decreases absorption, vitamin D deficiency, furthermore add deficiency of the vitamin D, long-term treatment with corticosteroid and thyroid hormones because they affect the equilibrium of calcium, bowel or digestive disease that decreases ability to absorb. When you are taking supplementation to cover up your deficiency or completing your daily requirement, limit 500 milligram calcium at one time of the day. Do not take it with another calcium, high calcium thing. Like, do not take it with milk. Take it with water. Take the milk curd at any other time. If you need more calcium, like 1000 or 1500, if requirement is high, take it in divided doses. Spread calcium sources throughout the day. Start supplementing with 500, and as I said, you can make it divided dose if higher need is there. Absorption of calcium is decreased when taken with food rich in fibers, fat, iron, zinc, more fibers like spinach, coffee, alcohol, antacid. So do not take these tablets with them. Iron के साथ तो नहीं लेते, but बाकी इनके साथ भी मत लीजिए. Vitamin D, how it is important here for the bone health, because it is helping the calcium balance in the bone metabolism. So individuals who have more vitamin D, they are able to absorb more calcium. So keep good level of vitamin D, not only the sufficient level of vitamin D, but like 30 to 100 is a sufficient level. So keep on a higher side, not on a lower side of the sufficient, especially in this age, so that you can have a better bone metabolism. In combination with adequate vitamin D and 800 milligram calcium, the healthy diet, with the help of healthy diet, it can be achieved. Or if you need, you can add on supplementation. Vitamin D rich sources on the left side, these are the sources which are the vegetarian part: mushroom, oranges, banana, spinach, yogurt, tofu, soy milk, cereals. And on the right side, there are various things which are rich in vitamin D. So these are the on the non-vegetarian side. Though the sun exposure is the best and highest thing for the vitamin D synthesis, but in the advanced age, there is limitation of vitamin D synthesis, especially 50 years or older. And we can see that even the timing of the day, season, latitude, pigmentation, these all things also affect the vitamin D. So even if you are taking sun exposure, which is rare nowadays for us, but even if we are taking or our patient are taking, that is also not completely sufficient. Which can be the vitamin D deficient population, and where in whom we have to take special care: age more than 50, dietary intake low exposure of sun, dark skin, pollution, overweight patient. They usually remain vitamin D deficient. Gastric bypass surgery, allergy, lactose intolerance, and liver and digestive disorders. Vitamin D deficiency can be treated, as I have iterated earlier. But apart from that, the maintenance therapy, I will like to highlight that maintenance therapy is important. So either you give one sachet monthly for the maintenance. After weekly sachet of 60,000 international unit for 8 to 10 weeks, you give monthly sachet for the long term. That is daily requirement. 60,000 is 2000 per day requirement. So that should be continued. Or even if you wish to give the injection, you can give the injection in once in a year, 60,000, or you can give in 6 monthly in the winter time, the 3 lakhs international unit twice a year in the summertime, or 6 lakhs units once in a year. Or oral tablet you can add on with calcium 2000. Management of sleep hygiene. So practice sleep hygiene. It has been discussed many times. At a particular time in a quiet dark room without large meal at night. Don't use nicotine, alcohol, and maintain dim light and good environment. And do not do exercise just before sleeping. For mental well-being, you try to learn new things, pursue new hobbies, continue working, become social, make bond with the family, and participate in the social activity. Be happy and remain contented. That also helps you managing menopause positively. So you can get indulged into the prayer meditation. That also makes your mind calm, and cluttering in the mind and fogging, etc., reduced. So you can make your memory better. with the practice of the new hobbies, new learning things, you can keep your memory better. And if you do not live with if you do not have expectations from other and you remain self-sufficient, self-dependent, then you feel happy and you manage your problems well. Physical exercises, I will like to say that we all know the various points regarding the benefits of exercises, but still we most half of us do not used to do, and many of us say that we do lot of physical activity, हम थक जाते हैं बहुत सारा, तो हमारे पास टाइम ही नहीं एक्सरसाइज करने का, हम नहीं कर सकते. We used to up and down on the stairs, we used to wash clothes, but things are different. In this slide, last line, you read that both are important for the health, the physical activity as well as exercises. Both have different impacts on the life. So we should have the combination of both. Exercise should include aerobic, muscle strengthening, breathing, and the balance. 30 minutes of moderate intensity physical activity, 5 days a week. You can take a break of 1 or 2 days. Muscle strengthening is must for at least 2 days, because in this age group, muscle strength is very important. 30 minutes just for general fitness, 30 minutes exercise, and reduce risk of chronic diseases. But for the cardiac and weight gain and all, you need 60 minutes. 90 minutes if you wish to avoid the regain of the weight and you wish to continue the weight loss. So that is the part of the exercise. Other therapies, not much of the things of vasomotor management we are including here. Asha madam has said a lot of things about that, and even we are not talking much about that. As I said, that for the MST, for the vasomotor symptom, it is not the first line drug. First line drug is MST if it is due to estrogen deficiency. Few new molecules are coming, like fazolinetant is coming, the NK3 receptor antagonist, which is having licensed for in some countries for the treatment of VMS, and in India also few companies are trying to get the license, FDA approval also for the treatment of vasomotor symptom of menopause, where you cannot give MST. But still, this is ongoing process, and we need to see the results and reports and the approval, etc., before trying for this. So another option is open with us. I have taken this reference for the students MenoMaster Gurukul program, which has been made by the Indian Menopause Society. So we all should remain on the same page. So the general management I have discussed here. The last line for conclusion, I will like to say that menopause is a natural phenomena, and various things we can maintain with the natural way. If it is not controllable, then definitely we have the armamentarium to add on like MST and other things. But if not, then it can be sailed through easily. So good lifestyle with self-care is a key point to navigate this natural phenomena, which is little wavy. So navigate through menopause naturally, beautifully, blissfully, happily. Thank you so much.
Thank you so much, Jyoti ma'am. Thank you so much for making the topic so interesting and so simple, actually. You simplified really well, ma'am. Thank you so much. Now I would invite Dr. Abha ma'am to share her insight about this session. Abha ma'am, you there?
Yes, I'm there.
Thank you, ma'am.
Actually, Jyoti ma'am has explained everything so beautifully and in detail that now I'm not finding words to express, how beautifully she has told about managing the menopause and other therapies. Thank you.
Thank you. So,
Thank you, Abha.
I would thank all the chairpersons for the same. I would thank you so much, Dr. Abha ma'am, Dr. Reema Dilawari ma'am, Dr. Sunita Kanoi ma'am, Dr. Ritu, and Dr. Sushila Khunte. Thank you so much, everyone, for joining in this webinar. Now, I would invite Dr. Asha ma'am to say a few words.
So I had listened to this talk of Dr. Jyoti in IMS Con. He was standing at the back, and I heard it in, you know, when we did the Mino Master. But again, the more you listen, you learn something new, something clicks, that उस समय सुनते में ये छूट गया था. And after the activity part, what I would like to share here is, I'm a practical example. I have severe osteoporosis. If I do not exercise, I find exercise is the key to healthy living all your life. You don't exercise, no medicine works. No analgesic, no ibandronate, no denosumab. Nothing is going to work if you don't exercise. So the crux of everything is you need exercise first. And then you go on adding to it whatever is required. It was really beautiful, Jyoti. It was very nice listening to you. Thank you.
Thank you so much.
So now moving on to ahead.
Just a second. I would like to thank Shalini as well, who has made so much effort. She is the one behind this entire effort.
Thank you, Didi. Thank you.
She is a very good secretary, we can say, doing her job doing her job very sincerely, meticulously. So RMS को सही पर्सन मिला है अभी सेक्रेटरी के लिए. पहले भी मिलते रहे हैं, अभी भी मिला.
Even I missed going to AIMSCon Kanpur. Couldn't go because exams चल रही मेरे बेटे की. But Asha Didi also told me, and I was really willing to go, but could not participate. And
next time is always there, dear.
Yeah.
कोई ज्योति दीदी बोल रहा था.
हाँ, मैं बोल रही थी ज्योति दीदी कि नेक्स्ट टाइम से ना आप एक स्लाइड एक्सरसाइजेस की भी ऐड करिए कि जो ऑस्टियोपोरोसिस में ये जो पोजेस और जो एक्सरसाइजेस ज्यादा बेटर हैं योगा के और दूसरे भी जो
श्योर टाइम
वो आप ऐड
लिमिटेशन
करें.
थी ना, अब आशा दीदी से डांट नहीं खानी थी, इसीलिए जस्ट आई kept it short. But definitely these topics can be even become a part of symposium, like one on calcium, one on vitamin D3, one on exercise, one on mental well-being, one on this. So this was just a crux things. But definitely it can be added. Thank you for your advice.
Okay.
So moving on to our session, we are going ahead to unveil our newsletter. And the editors of our newsletter, Dr. Vinaya Mayaskar ma'am and Dr. Saurabh Birthare sir. So, Dr. Vinaya ma'am. Dr. Vinaya ma'am.
Yeah, I'm there. Yes. Can you hear me?
Yes, ma'am. Yes, ma'am.
Yeah, I'm there. Yeah. Okay. You want me to take over?
Yes, ma'am. Yes, ma'am. You take over, ma'am. I'm stopped sharing.
Yeah, actually, very good afternoon to everyone. And this was a very short notice newsletter, but I wanted to do it this month because we want to maintain that chain. And that IMS conference was there, so it got little delayed. But I'm very happy that this month on the last day, we are ready with the newsletter. And I'm trying to focus on the activities the society is doing because that should be known to the members. So I have highlighted all the public awareness activities, the CMEs, the GPMs, GCMs, the talk of Dr. Febe, and a very interesting recipe by Dr. Reema, and of course, our laughter corner as usual. So I request Asha Jain madam to share screen. She has the newsletter so that, Asha madam, can you hear me? Ritu, Dr.
Yes,
Asha.
I can hear you, my dear. Give me half a minute. Meanwhile, you can talk about it.
Yeah, I'll talk. First, I'll thank Saurabh for the inputs, which he's regularly doing. And yes, Shalini is a diligent secretary. She always provides me the matter of the activities and dates, exactly what they are. And of course, Asha madam, you are the force behind the beginning and the continuation, I would say, of the newsletter. So I think we keep going with the energy and the responses that the members give back to us. So again, looking forward to your response for this newsletter. And okay. So that's the, madam, you can open it and scroll it as well. So that's the first public awareness by Asha Madam on Republic Day. And we also have shared the QR code for voluntary contribution for activities of RMS, that is ₹1,000, one time 1 year payment. And other activities by Saubhagya and Dr. Saurabh. And of course, Dr. Sushma has put in a lot of efforts on the Sarvodaya Hospital. Febe gave a wonderful talk on the day of GBM, which we have concised and put it up. Tranexamic acid in the management of AUB. And lastly, a lovely recipe by Reema. You can see the colorful photos of the ingredients that she has put up. So thank you, Reema. Impromptu in one day she gave me. I love that. And the quiz winners, they always be our heroes. So all of you, please participate again in the next month's quiz and get featured in the newsletter. Thank you so much. Saurabh, you can also start your video.
Yes, ma'am, my video is on.
Your video is on. Okay, I can see. Yeah, fine. So,
Saurabh,
Asha
you
madam,
want to say something?
No, ma'am.
You
Yes,
should, my
indeed,
dear.
when
You
you
should.
feel that
one
Say
line you
something.
can
Say something, Saurabh.
And everyone else, if you want to give your inputs of what we should include more in our newsletter. Yes, Dr. Jyoti.
Thank you, Asha Didi. Somehow I had shown one my small write-up on balancing relationships in midlife. Just nearly 500 words write-up I had made. So she suggested me to put up in the newsletter. So if it can be included,
In the next one. We'll do it in the
yes,
next one.
Yes, in
Right.
the
Because
next
see,
one.
in the next one, all our 4 talks we will have to give in 500 words.
right.
Because
Right.
we've done it in February, so all 4 talks will go in 500 words. So if
Okay.
you want to put it in this one, fine. Otherwise, in the next one, we put that.
I
Because
have both the things. So whatever you suggest,
we will put it in the next. We need matter for each one.
We have
So
many
this
activities
time,
this year. This month
it
we have
was a
Dr.
many
Jyoti,
little,
activities.
it was a general kind of thing
yeah,
for the
but
even the
this
club
month we
35.
have
Very
to
good
put
thing.
in these 4 excerpts. जो
Yeah.
हमारे talks थे, that has to go in. हमारे
Right.
dance के कुछ photo जाएंगे.
Dancer size भी किया
Dancer
है.
size जाएगा.
गुरुकुल किया है.
A glimpse in
गुरुकुल
the
जाएगा.
ISKCON. Yes.
Camp किया है. Camp किए हैं 2.
And one more thing, I
आपका
had also
putting up
done
that
one
report as
BMD.
a treasurer, वो वाला photo जाएगा. So
Thank you.
we will put everything. So
we
this one is a busy one.
We can always discuss when one newsletter is in this. So for the next month, who is almost ready, that can be done. I have also done one BMD camp in the department for the poor patients. I
Please
have
Dr.
share.
organized.
We will put it in the
please,
next one.
you please put it to my personal chat if possible.
I did a camp. मुझे
Jyoti,
दीजिएगा.
personal chat
दीजिएगा.
also to
मुझे
our
दीजिएगा
group.
because I need to send activity report. So I'll share to our group, RMS group.
And dear friends, everyone, anyone wants to write anything, you want to give a joke, you want to give an article, everything is welcome. It's our own newsletter. So let us all get active and start writing whatever feel like.
And I am even giving one suggestion that if every newsletter, in case by chance, if your next annual conference remains there, and if you make one souvenir for that,
Yeah, we are
the
already
whole
having that
newsletters
bunch
can
ready.
get the compiled and can be put up in that.
Okay,
Just a
I'm going
suggestion.
to
already
add
compiling.
something in this newsletter. In the February newsletter, we will put up the dates we have decided for our annual conference.
Yes.
So we will put that up, and also the QR code, and we will have to take a small meeting and decide what we are going to keep the fee and everything, what faculty we want to, if we have time after Ritu's lecture, we can do it for 15 minutes right now. There are a lot of people, we can just discuss what we are going to do in that conference. And then from the next newsletter, we make it fast, and Women's Day पे release करना होगा तो उस दिन release कर देंगे. And we will just flash it out. Let's do it in a good way. Okay?
Yes.
So
I request everyone, despite putting in group, if you can put it to my personal WhatsApp number, I tell people also, just send me to my personal note so that I can just keep them in one after other, I keep them floating. So otherwise, I always request people that you send something if I don't find it. Okay? Yeah, that's nice.
and any good recipes, millet recipes or traditional recipes that everybody has a different traditional recipe, whether
Yes.
it is a Marwadi recipe, Punjabi recipe, Chhattisgarhi recipe. So we need to put those recipes and their health benefits because traditional is good.
Lentil dal, masoor ki dal, good soya.
Mhm.
So we
Okay.
need to, make that and put few recipes. How does it matter? But I personally feel that I want to go traditional, not the ultra modern recipes.
नहीं, छत्तीसगढ़ी मसूर दाल आज ही पढ़ाई ना.
ठीक है,
Sure,
ठीक है.
Dr. Jyoti. Okay.
So please
So thank
share
you.
and let us make it our own. And right now we have 34 people, requesting each of you to talk to 4 more people. So that next time when we do the program, we have 120 joining in.
Yes, sir.
At least physically it is difficult, but online it's not tough.
Yeah. All
Yeah.
can come.
So,
Yes, sir.
all right. Thank you
Yeah.
so much. Thank you. So after Ritu's lecture, we have a discussion.
Yes, ma'am. Moving on to our session ahead. Next session is on financial freedom after 50 by Dr. Ritu Jain ma'am. Chairpersons for this session is Dr. Vinaya Maiskar ma'am. Dr. Vinaya Maiskar ma'am, she is editorial. She is right now she has unveiled her newsletter. She is life member of SR and Amasi and editor of RMS monthly newsletter. Dr. Neerja Agrawal ma'am, she is Gurukul in Gurukul activity module menopause for postgraduates Menomaster in RUGS. She is at present professor and HOD at Balaji. Dr. Veronica ma'am. Veronica ma'am is director at Veronica Yule IVF and Fertility Clinic. Dr. Ishpreet Kaur. She is senior consultant at Sri Kalyan Multispeciality Hospital, Raipur, and AP at RIMS Medical College. I request Dr. Vinaya ma'am to introduce our speaker, Dr. Ritu Jain ma'am. Dr. Vinaya ma'am. Okay, Dr. Veronica ma'am, please, you take over.
Yeah. Can I share?
Dr. Veronica ma'am, please introduce our speaker, invite our speaker.
Okay, Ritu, a dear friend of mine and a very senior person now in the Raipur Menopause Society. Dr. Ritu has been the convener, she's a consultant at RIMS Medical College as well as her own Sri Mahavir Hospital. She has been the convener and of Digital Education Committee of RMS 2023 to 25. Currently a member of the endoscopy committee and executive of the CGSR 23-25, Foxy committee member, even a prestigious executive committee of the Raipur Obstetric and Gynec Society, has been an organizing secretary of MenopauseCon 23 and 24. I welcome her for her talk on financial freedom after 50.
Thank you, Veronica ma'am, for that introduction. Ritu, can I share my screen?
Yes, ma'am. I've started.
Ritu, I'm again muting everyone.
Yes, ma'am.
And then you can unmute yourself.
Yeah. So I will just like to put this topic as empowering women with financial wellness after midlife. So why are we talking on this is because as we navigate through our 40s and approach our 50s, we are often finding ourselves at crossroads and our careers are at peak, our children are growing, and retirement is no longer a distant dream, but a looming reality. So this period can be really exciting as well as daunting, especially if it comes to our financial health. It is not just about having a large bank balance, but it is also having the peace of mind that comes from knowing that you are financially secure. It is always being able to make the choices which align with our values and goals without the constant worry of having money. So how do we achieve it and what does it mean to each one of us? Financial freedom becomes important because it will secure us, it will help us deciding choices, it will empower us, boost our self-confidence, and it will also help us to pursue our own hobbies. So living free from financial stress, managing your own finances and investment, choosing whether you want to work or whether you want to retire, this itself gives us an empowering feeling and a confidence. It gives you a time to allow you to pursue your passions, your hobbies, support your lifestyle, and you have to live debt-free and financially independent to be free of this stress. So it could be a different definition for each one of us. Why particularly midlife? Because this is the age where we have specific challenges which we face. First and foremost is reduced income, which could be due to the retirement or reduced working hours because of our own health issues or because of family commitments. It is increased healthcare expenses because as we are all discussing midlife, we do face a lot of health issues due to menopausal transition, premature menopause, and many others comorbidities which start at this age. So our healthcare expense definitely goes up. Caregiving responsibilities is inherent to every woman. We always keep our family responsibilities ahead of our own importance. So we don't really keep our priorities as a important thing. And that itself can be detrimental when it comes to our own health and finances. And another important, which applies to, including me, which applies to me also, limited financial literacy. So when I got this topic, I'm no CA, I'm not a financial advisor, I'm just a clinician like you people. When I got this topic, I myself started reading about itself, and I also understood that I am also very limited in my financial literacy. So these challenges of investing, financing, retirement planning, it was nowhere on my mind, but now I have started working on it. So how do I go about it? These are the points which I read and which I found very useful, and I've just put it in a point-wise fashion. Setting up long-term financial goals, define your vision of financial freedom. Start by identifying what freedom means to you. Consider your personal values, long-term aspirations like travel plans, retirement plans, supporting your family members. It could be just paying off your mortgage, funding your child's education, or just a comfortable home. Set your specific goals which are achievable, measurable, and realistic. For example, aim to save a certain amount of retirement amount. Pay off your high interest debts at the first with defined time frame. Set up achievable, clear goals, and this will help you keep focused and motivated. Create a detailed action plan. Develop a step-by-step action plan. This may include budgeting your percentage of your income and then investing it and exploring in the various options. Second is creating and managing a budget. Track your expense. Regularly monitor all your income and expenditures to understand your spending habits. Use various budgeting apps, spreadsheets to categorize and visualize your expenses. Prioritize your needs, allocate your resources. Identify the essential expenses versus the discretionary spending ones to focus on what truly matters. Always allocate your funds towards savings, debt repayment, and necessary living cost, and aim to save at least 3 to 6 months worth of living expenses for emergencies. So building an emergency fund is a very important part. Importance of an emergency fund. It provides a financial security during unexpected events and reduces our stress and anxiety related to the uncertainties. How do we save it? It is very easy to calculate. Approximate a 3 to 6 month worth of living expenses has to be determined. That is your target amount, and set a goal to create it and reach it gradually. Benefits of high yielding saving accounts can't be underestimated. Keep funds accessible while as well as growing your savings. Always manage your debts effectively. Identify your high interest debts. Start by listing them highlighting those with the highest interest. Focus on credit card debts, personal loans, because these are always the highest ones, and try to repay them at the first. Create a repayment plan, develop a strategy to tackle them, allocate extra funds towards these debts while making minimum payments on others to reduce the overall paid interest. Explore various refinancing options if required. Investigate opportunities to refinance your high interest loans at lower rates. So this can reduce your monthly payments and total interest over time, making debt more manageable. Always try to establish a budget for debt management, prioritize it, track your expense, identify the areas where you can cut back your funds, and ensure that more funds are directed towards this. Always invest wisely. Diversify your investments. Explore a mix of assets like classes, stocks, bonds, real estate, so that there is risk reduction as well as you enhance the potential returns. Consider low-risk options. Look into fixed income securities, government bonds, high-yielding savings account. All these will provide you stability and predictable income. Always align investments with your retirement goals. As I earlier mentioned, set clear retirement objectives and choose the strategies which will support your desired lifestyle and financial security. Always consider consulting a financial advisor to create a portfolio which will align with your risk tolerance and retirement goals. Coming to the main part, plan for your healthcare costs, because this is the most neglected point. Most of us will never think that we are going to spend a lot of money on our health. So always plan for it. Make health your priority. Take health insurance coverages. Evaluate and select appropriate insurance plans which will cover all the essential services as well as the preventive ones. Preventive care services, always utilize various free low-cost screenings, vaccination programs, maintain your health, and prevent various costly treatments which are not required. Estimating expenses for these treatment plans and potential long-term care is very important. Emergency fund for health expenses is a must. Budget for your health-related expenses. Create a dedicated budget for the regular expenses, especially the premiums, the out-of-pocket costs, and long-term care plans. Always focus on preventive healthcare, like schedule your regular checkups, stay current on the recommended screening protocols of mammographies, colonoscopy, bone marrow density, etc. Adopt a healthy lifestyle. We can't ignore this point. This is the most important point. Maintain your balanced diet, engage in regular physical activity, and ensure adequate sleep to support your overall well-being and reduce the risk of chronic diseases. Do not forget management of chronic diseases. You have to always collaborate with your healthcare providers, establish a strong relationship with them, regularly communicate with them regarding symptoms, treatment options, progress, various comorbidities like diabetes, hypertension, osteoporosis. So these all will require chronic management. Effective medications. Discuss with them the regimes, the dosages, the potential side effects. Use various tools like pill organizers, medication apps to stay on track and not forget your treatment protocols. Improve your lifestyle, adopt a balanced diet, regular exercise, incorporate stress management. Techniques like yoga, meditation, this will go a long way. Monitor and adjust all your treatment plans. Always prioritize your mental well-being. This can't be neglected because it is linked to the mental well-being. The stress can harm both health and finances, making it vital to prioritize your mental health. Mindfulness, hobbies, and professional support are key to reducing it. Utilize various therapies, support groups, various techniques like meditation, yoga, deep breathing exercises. Maintain social connections. Plan for your retirement. Maximize your retirement benefits. Understand your long care options. Consider your long-term care insurance options and advanced care plannings. Always start by optimizing your pension and social security schemes. Consider delaying use of securities to increase your monthly payments. Ensure more secure income. You have to understand the long-term care options like home care, assisted living, nursing home care, and assess the cost which is associated with each of them and make informed decisions. Your care insurance planning has to be understood. They should cover your potential costs and extended care, and this will provide you protection and peace as you age. Advanced care plannings like living wills, power of attorneys, so that your healthcare wishes are respected. These are crucial for making informed decisions about your care if you're not able to communicate your preferences. And last is staying informed. Read various financial news, market trends, investment opportunities, and economic changes through various reputable financial news sources. Attend various workshops, webinars, seminars to understand which are focused on financial literacy, retirement planning. They will teach you the investment strategy. They will enhance your knowledge. Don't shy away from consulting financial advisors. Always seek a professional advice to tailor your financial plans to your specific needs and ensure informed decision about investments and retirement options. I have put this second part in the talk is mainly focusing on the healthcare cost management, because this is the main expense which will take away the main chunk of your savings. So where there are various innovative ways, we'll just enumerate in short and not discuss much, innovative ways to manage your healthcare finances effectively. This will include your medication cost and also how to use the technology for it. So always try to make use of generic or ethical brand instead of brand medicines to cut down your cost without compromising on quality. You can also explore the patient assistance programs which various pharma companies run, and these are allowing the eligible patients to receive free and discounted medicine. It is always essential to research and apply these programs so that we save a lot of money. Utilize various discount programs which are available like 1mg, the India Mart, and many more which are nowadays available. Always try to offer bulk prescriptions in cases of chronic disease management. So these resources can effectively manage your medication expense and maximize your savings. Various affordable activities, government-backed ones like the Medicare, Medicaid, India, which run in US, and corresponding programs which run in India. These are affordable care acts which will allow the consumers to access and benefit the various health programs, overall care quality and affordability. Various state-specific programs like the Sanjeevani one, which runs in Chhattisgarh, or the Rajiv Gandhi Yojana, which runs in Maharashtra. There are local programs which are specifically cashless treatments focusing on healthcare of the elderly. Make use of various national schemes like National Health Mission, Ayushman Bharat, Pradhan Mantri Yojana. Lot of insurance schemes run by the government. I've just mentioned them, like Indira Gandhi National Old Age Pension Schemes, NPHC, Varisht Medical Policies, Rashtriya Vayoshri Yojana, Varisht Pension Bima Yojana, Citizens Welfare Fund, various sammans which are available for senior citizens, iconic mother awards for single mothers, reverse mortgage schemes, and various PMJY, which we all know. So these are the various government-backed schemes which can be made use of. We can also make use of community health clinics for low-income groups, which offer various primary care and preventive services and behavioral support to this aged population. Non-profit organization can be made use of various National Council on Aging, HelpAge India. All these provide services, rehabilitation, and social security. Their main focus is on enhancing the quality of life for seniors while ensuring that they have access to necessary healthcare. Various public-private partnerships, infrastructural development, pooling of resources, expertise, and finances from private sector leads to improved service delivery and expansion. The various corporate social responsibility run by the various pharmaceutical companies can help in healthcare interventions, supporting the community health initiatives, funding various programs, and enhance the local health infrastructure. Preventive health strategies like free and low-cost health screenings, like we did the cancer screening at the Marine Drive last month. So such screenings should be made aware to our patients, elderly patients who can make use of this, and they can get screened at low or no cost. Stay updated on vaccination immunization program, educate your elderly patients, your midlife patients, so that they can make use of this various facilities. Various health fairs, community events, they have a role. They serve as a platform for disseminating various health information and provide screenings. By fostering interaction between the providers like us and the public, they will enhance the awareness amongst them. And always this collaborative effects with the NGO will amplify the outreach programs, facilitate the resources, expertise, and volunteers to maximize the impact within the underserved populations. You can always give your patients and your midlife women options of using various CAM therapies, alternative therapies for wellness, pain management, stress reduction, which are also cost effective, as well as they give us necessary mental stability for doing the financial decisions. Various financial models like tax advantage savings, usage of medical expenses, these can be used for qualified medical expenses, including deductibles, co-payments, and prescription medications. They provide a financial safety net for unforeseen cost, enhancing the access to necessary care. Innovative models like microinsurance, crowdfunding, these are online platforms which will allow community to support each other for treatments that may not be covered by insurance. Always, it's a good idea to negotiate and cost reduction strategies to be worked upon. Negotiate with various medical bills directly, understand the cost, be proactive. Medical tourism is another very cost-effective option. By leveraging low-cost and high-quality services, individuals can assess this treatment without incurring exorbitant expenses. Always try to integrate technology like telemedicine or digital platforms. This allows the patients to consult with healthcare professionals remotely, especially advantages to rural and underserved population, breaking geographical barriers. A very well example in Chhattisgarh is the 104 toll-free number, where I have had the privilege of serving for 1 or 2 years, where I really understood that the geographically difficult areas like Janji, Chapa, Jagdalpur, these people, they do not have any PHC or CHC in their 100 kilometers radius. And these were the people who used to avail these services. And it was very helpful for them. So these technology can be really made use of, and we can really serve them through this. Digital health record is another important for continuity of care. Information in real time facilitates better coordination among various providers and improves the continuity of care and patient outcomes. So telemedicine, we all know the digital health platform. It is easy access to the services, shorter travel times, shorter wait times. It enhances patient tracking as well as their care. It is an affordable option, and it has a better communication with various providers and the patients. Various mobile applications for chronic disease management, such as diabetes, hypertension, they will provide you critical reminders, educational resources, tracking features, and enhance your health management strategies. It also engages patient. It has its own educational tools. So it is an accessible educational material and self-care strategy for our patients. So enhanced engagement through this technology will foster a proactive approach to the health and encourage individuals to make informed choices. So health applications will give you health tips. It will be a health tracker. It will also auto schedule and streamline various processes. AI symptom check will give you smart algorithms to evaluate symptoms. So even the patients, they are in a very easy patient understandable language, so they can use it for themselves and approach their healthcare providers when needed. These are seamless connectivity, enhancing data collection and health. So artificial intelligence, yes, for predictive analysis, leverages the data analytics to predict various trends, outbreaks, better resource allocation, and proactive healthcare measures. It aids in identifying the at-risk populations and enhance the preventive care which we can take for them. It enhances our own clinical decision-making as well. It will assist us in clinical decision by the use of various algorithms. Capacity building training can't be underestimated. We have to enhance our patient care. Mentorship has to be given to healthcare providers, caregivers, and it is always a teamwork and communication between us and our patients. Various health and digital literacy programs for the elderly will be very helpful for them so that they grasp the key health concepts very effectively, navigate through various digital apps and platforms easily. They equip themselves to the practical knowledge for effective app application, and they will think critically so that their analytical skills to evaluate their own health will be a good idea. What government can help us do is we have to educate these government officials when they come in our meetings, when they come to our platforms. We can make them understand the need of requirement of reforms. Advocacy is essential for reforms, which will enhance the healthcare access, especially to this midlife women. Emphasize various age-friendly policies to them, social security schemes, financing reforms, which are very much required. And last but not the least, set up various automatic transfers to the savings accounts, schedule regular transfer so that you pay yourself first and then do the rest of the expenditure. Promote your financial discipline, ensure funds that they are reserved before spending. Over time, this will lead to significant accumulation of your health. Utilize various tax advantages accounts like EPF, which is available in India. Various accounts will allow the individuals to invest for their retirements while deferring the taxes and achieve a tax-free growth. So understanding the contribution limits and tax implications associated with these accounts will help individuals maximize their retirement savings and build wealth. Last is financial apps and digital tools, which can be really helpful in transforming our finance management because they will offer us budgeting, expense tracking, investment management, and financial planning. By leveraging these resources, we can gain real-time insights into our finances, set our goals, track our progress, and this convenience of technology will make it easier and proactive and allow us to make informed financial choices. So the take-home message is achieving financial freedom. It is not only the peace of mind of knowing that we have a lot of money back home, but it is the peace of mind to make various choices which are aligned with personal values, especially of midlife. I will make it midlife, not 50. We have to take proactive steps like setting up long-term goals, create budget, manage our debt, and this will be very essential for securing our future. Prioritizing health and wellness, including preventive care and managing costs, is crucial for maintaining financial stability and overall well-being in later years. Innovative financial techniques like medication costs, staying informed on government schemes, NGO, private public initiatives, and leveraging technology will empower the elderly to take charge of their financial health. And by utilizing various generic programs, discount programs, automation, alongside the tax advantage accounts and financial apps, one can achieve significant savings and effectively manage their finances. So that brings to the end of this talk. And it was a very different topic for me as well. And I think when I got this topic, I started reading myself. And I think I have to apply many of the things out of this. So I look forward for more inputs from the seniors who are sitting in the audience, that if we could enhance our knowledge on this topic.
Thank you, ma'am, for such elaborative talk. I request Neerja ma'am to conclude the topic. Neerja ma'am.
I don't see her. May I say something?
Yes, ma'am. Yes, ma'am.
Ritu, that was a really well put together presentation.
Thank you, ma'am.
Very well. But the basic thing that we have to guard against, you have emphasized a lot on the use of AI.
Yes.
And apps. But the thing is, you need guidance on which app to use, because apps are dime a dozen. And most of those apps
there is some
someone is logged with 2 devices. I guess.
Now can you hear me?
Yes, now it's okay.
Yes.
So what I'm saying is that these apps, many of them have bugs, many of them take up your data and misutilize it. All the apps that tell you how to use your money, how to actually reinvest it, most of them are crap. Okay, so just relying on them does not work. You get cheated left and right. You will put in your money. They'll say, we are doing it for you. There are a number of apps that do all this. So when we talk of AI, we need to understand that AI is as good as the person who made that AI and the person who's using that AI, especially in finance and healthcare. Security, access, decision making has to be in your hand. If an app can in any way monitor all that, it's going to be more harm than good. Yes, we all need financial independence. We all need to think of finances. But more than that, जो है उसे भी हम गंवा ना दें, ये हमको सोचना होगा. So a human intervention, a good CA, a good financial manager is a necessity. The thing is, even we all know that not every professional will know everything. We are now in menopause society, so the amount we have studied for that exam and know about menopause, others would not know, and nobody would actually like to say कि मुझे नहीं मालूम है.
Yes.
So you need to find a correct person, because everybody doesn't know everything.
Yes.
Right. And in CAs, that super speciality concept is not there.
Not there. Yes.
So always try to search for the right person and read up, use everything so that you know that you're not being cheated.
Yes.
But ultimately, you need to rely on humans to get things done. And you need to think of your finances. Unless you are basically of that sannyasi mentality that God will take care.
I am not, definitely not.
Means if God is going to take care, it is the Bhagavad Gita mantra, Yoga Kshemam Vahamyaham, which LIC has taken over. But it is actually God who has said Yoga Kshemam Vahamyaham. So unless you have that, you need to think and plan and hope God agrees.
Yeah, Jyoti ma'am has to say something. Yes, ma'am.
Asha Jain ma'am had rightly pointed out about AI, and I would like to add something about the first part you have covered, that what we ourselves can do. See, we are not discussing this only for the ourselves. Definitely for ourselves, we are a educated person and we can go ahead and take the opinion of the specialist, etc. And we used to do it. But for the menopausal age group, women especially, for the care of them and for the care of their partners, they need to understand the basic things जो पुराने जमाने में भी होता था कि सब अभी ही नहीं लुटा देना है आपको, आगे के plans के लिए भी you need to, like many of the times the our elderly, my mother always says that I just want to give up all my jewelry to my this daughter, my that daughter, my this bahu. But they need to understand, and our patients also need to understand that their security is must. Till they are having their arrangements for themselves, first it is their own responsibility. They should not think that our children will take care. So this is one of the part that they should always, it should also be in one of the counseling, that you take care of your monetary aspect, that you can take care well about your health. And when you have the wealth, the other will also take care of your health, otherwise they will not.
That's the reality. That's the reality. We should never forget.
I would like to conclude the session, Ritu. I just missed the initial slides, but later on I heard everything.
Yes,
I
ma'am.
think you opened up a wide horizon of aspects of financial health, which I think many of us were not aware. So congratulations for that, and covering so many schemes in one go. I would appreciate your efforts. So
Thank
very
you.
nice.
Thank you.
Thank
Ritu, I was always there all the time. And the best example is COVID, I think. Because COVID taught us many things about financial things. Many people lost their jobs. And that is one thing which we should be literate about, that emergencies can occur at any time and at global level as well, in spite of our family level. Secondly, you put it that everything should not be in one basket. So that is a good advice, that they should have different schemes. And every lady we are talking about in the menopause forum. So even the ladies should take part in their financial decisions, which are normally taken by the lead member or male member of the family. So they are just asked to sign that letter. जो भी इन्वेस्टमेंट किया बस साइन कर दो तुम साथ में ज्वाइंट करके. तो दैट इज अ वेरी सैड पार्ट, बिकॉज वो ट्रस्ट के रूप में करते हैं. And if one fine day, if she has to take care of the family because of some unfortunate event, then it becomes very difficult for her. And of course it should start from student life, so that financial which we are talking today at the age of 50, all of us should be taught very early in the life when they are PGs or start earning stipends. So that should be taught, because being a doctor, we think most of the hours in our patients or what diagnosis we are making, if though some amount of time we give to that reading also.
Yes.
So what is mutual fund, what is if we have some part of our time which how much ऑब्स गाइनी अपन पढ़ते हैं, उसकी जगह थोड़ा सा अगर अपन फाइनेंस भी पढ़ें तो maybe it would be good. So it's very well and topic apart from menopause, very well said. So congratulations to you.
Thank you. It's a high time even our school going children should have a lesson on how to make budget, how to invest, how to manage their pocket money. So even if
I request everyone, please put on your videos. We will take a group picture. Everyone, please put on your videos.